Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
But yeah, that's true. Okay. Okay, you can get started.
Wow.
Yeah, I thought that was being interesting. What are you answering to? You give us a poll. I can't understand what the poll is, but anyway. 5 medical conditions that mimic psychiatric disorders. Because we have conditions that people send you to a psychiatrist for, and actually they are actually a result of what is called a medical condition. And their terms of a medical condition are interesting because we know a number of diseases that are associated with people behaving as if they had psychiatric problems. And electrolyte imbalances can cause a lot of those kind of things. And we call it delirium when you don't make sense. And we talk about schizophrenia, mania, and other things, which are not associated with medical conditions, but there are 65% of delirium cases are mistaken for depression. And a number of medications have side effects that produce delirium. And these are some of those medications. And you've heard of people walking in their sleep and driving in their sleep, eating in their sleep, and those kind of things. Sometimes there are side effects of the medication that you may take. And just like Dow was talking about the cataract and the consequence of dairy products, and of course, any kind of electrolyte or glucose imbalance can result in this kind of symptoms.
Dr. Callender, what is delirium? What is that?
That's altered mental state. That's what it is simply. In which your mind is not functioning right. And of course, they usually refer to delirium, any state, anything that causes you to be mentally off course. In contrast to, and usually they relate this to medical conditions, in contrast to dementia, which they relate to cerebral conditions and Alzheimer's and those kinds of things. But with delirium, you usually don't have any mental problem. You've got some kind of metabolic problem that may be a side effect of medication, or maybe even electrolyte imbalance, because hyperparathyroidism is often associated with delirium, which was corrected by surgery and lowering the calcium level. So dementia, as we know, Alzheimer's is one of the commonest causes of dementia, which is, again, altered mental state. And you can have hallucinations and other things, visual or auditory. And most are able to identify by x-rays of the brain, MRI and others, those correlates, those things that are correlated with dementia. And there's a lot of discussion relative to which ones are associated with Alzheimer's and which aren't. And there are those that are just associated with the fact that you've got arteriosclerosis in the vessels of the brain, which cause you to have ischemic attacks and scarring in the brain and shrinking of the brain. Then, of course, the epilepsy, one of the interesting things is they used to equate epilepsy with mental deficiency. And they used to talk about epilepsy and being mentally disabled. And they used to put them together. So if you had epilepsy, they felt you were mentally ill. And so we now know, of course, that epilepsy is a completely different issue. And that after the epileptic event is over, the person returns to normal, and with medications, everything is stabilized. But in the past, in the old days, as a matter of fact, there was a time when they approved eugenics. And one of the things that is frightening about some of the things they did in former years was that the Supreme Court proved by a vote 8-1 that you could use eugenics on people who had epilepsy. And of course, we know that's awful. Anybody not familiar with the term eugenics?
I'm not.
Okay.
Me,
Eugenics refers to what was done maybe about 100 years ago. Maybe a little less, maybe 90 years ago, in which they decided that if you had certain diseases, you could be sterilized, because they're trying to make a healthy nation. And so in terms of trying to make the nation healthy, they would sterilize people who had mental disorders or other disorders, and they felt that they should not be allowed to perpetuate the species. And of course, the Germans and the Third Reich took this to another level, where they were killing off a population that they felt was deficient in the effort to create a wonderful white race. So that's what eugenics was all about. Sterilizing people who weren't up to snuff, and creating a white race that was superior to all. Anyway, that's part of what eugenics is about. But the tragedy is that the Supreme Court could approve something like that. Man's inhumanity to man is sometimes amazing. Then, of course, there's traumatic brain injury, which we see from many of the veterans and people who have skull fractures, automobile accidents that can cause neurologic dysfunction and neuropsychiatric sequelae, which are really the result of traumatic brain injury. You have depression and all of these other symptoms that are the direct result of brain damage. And then that is thought to be why you have so many veterans who post-traumatic stress disorder and also commit suicide. And then an infection, any infection with septicemia can alter the mental status. And there's so many infections, and sepsis is something that we know alters mental status. And then after the infection is cleared up, then people go back to normal, meaning that this was a state that was induced by the infection.
Dr. Callender, there was a report about head trauma to NFL football players.
Right. Good example. Traumatic brain injury. Right.
And that might have been what happened to Muhammad Ali in his later years, too.
Well, yeah, with his Parkinson's. Yeah. Maybe. Yeah. Any questions about any of that? Okay, we'll move to the next one. This is an interesting article over concern about the fact that as time goes by, your antibody level decreases. And as your antibody level decreases, now this is talking about the deadliest pandemic was 1918, over 50 million deaths. And talked about how over time we develop immunity. In those days, it was by herd immunity, which is a tragic way to do it because you have so many people who die along the way. And then when you look at the time it takes for the development of vaccines, you can see that the average time it takes generally to develop a vaccine is about 10 years. And some have been as long as 35 years. But we know that the most effective way of taking these infections is the vaccines. And there was a time when people could decline small vaccines, but eventually everybody relented, and that was one of the vaccines that if you were going to a foreign country, that was one of the vaccines you had to take. And that eliminated smallpox from the world. The vaccine did. So, and so the way vaccines work is you develop antibodies and sensitized cells. It's not the antibodies alone, but the antibodies and sensitized cell combine to eliminate an infection. And that's the purpose of a vaccine, to develop antibodies plus and sensitized cells that together they can eliminate the infection, whatever the cause. And so what it's saying is that immunity is more than antibodies, although antibodies are a good part of it. And so the components of antibodies are the humoral immunity and cellular immunity. And with what we usually talk when we talk about antibodies is the humoral immunity, but measuring the ability of the cells, the T cells, for example, to combine with the antibodies. It's not something that we've been able to measure. We've measured only the antibody titers. That's what the essence of this is all about, is that these cells, which are responsible for what we call humoral immunity, is what we look for. But actually, we need to look for memory B cell antibody as well as T cell function. Because the T cells are able to elaborate and cause production of antibodies as well. And so what they're indicating is that the antibody story is not the whole story. That's a major part of the story, but it's not all there is to it. And so we've got to be able to try to identify the T cells that function as well to see if, and it appears that the durability of the vaccine is related to not only the antibodies produced by the T cells, but also the T cells, which give you the cellular immunity. And that's why they indicate to you that even though your antibody may be waning, you still may be able to fight off the infection. And so as we look at the rate at which the Delta variant is affecting those who are not vaccinated and some of those who are vaccinated, this is, and the antibody story helped us to identify that people who are on steroids and immunosuppressants don't have the antibody titers that people who are not on those drugs have. And that's how we became aware of the fact that that special group and the group over 65 need more treatment than other groups. So what does this mean? It means that until the pandemic is over, we'll be able to use isolation and take masks and boost our immune response when necessary. And that's why they decided to give the boosters to those people who are over 65. And of course, we know already they're giving boosters to those people who are immunosuppressed. And of course, we know that we have breakthrough infections among the people who are actually fully vaccinated. And the emphasis has been on trying to get the unvaccinated to become vaccinated. Now, a statement of vaccinating the world is appropriate because I think we have to recognize that the closer we get to herd immunity by whatever means, whether it's by vaccination or whatever means, the more likely we are to eradicate the disease. Now, the question is, what percentage of the population do you think, of the global population, is immunized, is vaccinated from that?
Maybe 20%.
Probably less, but in that vicinity, probably 10 and 20%. Dow, you got any figure on that? But it's somewhere between about 10% probably. And I think we're trying to get World Health and everybody else to work together to make sure that those countries who can't afford it get the vaccine, because it's in all of our best interest to have as many people vaccinated as possible on the globe.
Dr. Callender, would there be a better way to determine the protection, the lasting protection of a vaccine other than the measuring antibodies? What do you think about that?
Yeah, there are ways. It's just probably more expensive. But to test for, we just found it's easier to test for humoral immunity than it is to test for T-cell immunity because it's easier. But I don't, so there is a way to do it. I don't know about the expense of doing it though.
Mm-hmm.
And there is a significant correlation between the body's ability to mount antibodies and the ability to overcome infection. So since they correlate, I think it's been attractive to do it that way. But there are tests to evaluate cellular immunity, as well as the so-called humoral immunity, which we usually test. Any questions about that? If not, this is an article I thought was very, because there's so much vaccine hesitancy right now. We have close to 200, but above 170 million who were actually vaccinated, meaning there's about 100, more than 150 million people who are not vaccinated. And so we've got a big problem. And so they decided to articulate and enumerate the reasons. And they call this cognitive dissonance, meaning that even though you know you need to change your behavior, you don't. Even though we have the facts in front of us, we still choose not to be vaccinated. It just, it doesn't make sense. But anyway, that's real, as we've talked about many times. That people know better, but they just won't do it. Then there's confirmation bias. We have our existing beliefs and we want to stick with them, whether it's reasonable or not. And then there's omission bias, which means we worry about the side effects, even though they are relatively small and few. We make that the reason for not getting the vaccine. And then the so-called availability heuristic, where we find it easy to think of instances where the vaccine failed and forgetting about the case in which it effectively prevented the disease, which is a common practice. And of course, the news focuses on the rare occurrences. And therefore, when people see that, they use that as a reason not to take the vaccine. And so we try to overcome it by information, as information is power. And so educating and empowering is something we try to do by all means necessary.
Dr. Callender, I talked to a young lady who said that she wasn't going to be vaccinated because um, they developed the vaccine too quickly,
Yeah, that's
which is not true.
Well, no, from her perspective, no. When you, it is true. We said it takes an average of 10 years to create a vaccine. That's the past history. So she's going on past history. Well, we've learned from our mistakes in the past, and we now do it differently. So it's not too quickly. It was done quickly, not too quickly, but quickly, and it was done safely. But if you're in the past and you say, well, it took 10 years before, why can't we wait for 10 years? The reason you won't want to wait for 10 years is because then you will have 50 million people dead. That's why.
The other thing, Dr. Callender, is that I saw a report where they were working on this vaccine, 10 or 15 years ago, because they predicted, I guess, by using computer models, that the next pandemic was around the corner. So they started working on the vaccine a long time ago.
Well, no, they started working on the technique, but they didn't start working on the vaccine. They started working on the technique that allowed us to develop the vaccine. That technique is the RNA model, which, as you say, was developed 10 years ago. It wasn't the vaccine, but it was the RNA technology that was new 10 years ago, and it's not new now. And so when people say they quickly developed a vaccine, yeah, that's true, but the methodology has been there, as you say, for more than 10 years. It's just that it wasn't utilized for a vaccine until now.
The other thing, too, in the report, it said that they knew that another pandemic was around the corner.
Well, yeah, 1918, 100 years ago. So, yeah, and that's why even Obama had a protocol for the pandemic, because you're right, it's at least it's about 100 years since the Spanish, they call it the Spanish flu, 1918. Yeah. Now, for those who wonder which vaccine is the most effective, this is an article that compares all three vaccines. And it said that effectiveness was highest for the Moderna vaccine and lowest for the Janssen vaccine. And although all of them are much higher than the flu results, it still allows you to say that Moderna is the most effective, although Pfizer is a close second. And this shows the degree over time, and in all time periods, Moderna was the one that was the most effective. They haven't done as many studies on the Johnson & Johnson vaccine. They've just recently done more studies on I think we have a study here that looks at the population over 5. But this is the bottom line. I think this is what is really more important, that all of them provide a high rate of protection against coronavirus. Now, this is a sobering thought that COVID-19 killed more people in the United States than the 1918 flu. Now, I think, as Darrell had mentioned before, the population now is 3 times what it was in 1918, but still, we still have outdone the 1918 flu in terms of the United States population. Not for the globe, because it's about 4.5 million in the globe, but and in 1918 it was close to 50 million. So it's clear that we don't want to wait for herd immunity. We want to do what we're doing now, vaccinating. Any questions or comments about this?
I wonder how it got called the Spanish flu, because Trump wasn't even around back then.
I think the veterans were coming back from Spain, and so they blamed it on Spain. But nobody really knows where it started from. Now, in contrast to this one, where we know it started from China. Yeah, that was interesting, that this historical occurrence parade that led to many deaths. What does Ecclesiastes say? That which hath been is which will be, and that which is done is that which shall be done. So there's nothing new under the sun. And lo and behold, that's true again. Can you imagine today, 2,000 deaths a day from COVID? frightening, isn't it? At this stage, that's kind of frightening.
So basically what you're saying is that 100 years from now, people are still just going to be the same way.
No, what I'm saying is that people are people. But when you say the same way, I don't know. What do you mean the same way?
About, they were saying, about wearing the mask, getting the vaccination and all of that. Or will people be even worse about, taking the precautions? They haven't learned from history. Because have we learned from history of 1918? Doesn't,
Well,
everything.
we learned to take the vaccine. They didn't have a vaccine in 1918.
Okay.
So that's one thing we learned, is that you need to have a vaccine. Our social behavior hasn't changed a lot, but we had enough sense to know that we needed a vaccine.
John, back to your question, what was called the Spanish flu. The flu started taking hold right after the end of World War I, and King Alfonso of Spain came down with a nasty case of the Spanish flu. And so people started to call it the Spanish flu because the King of Spain had it. But the people in Spain, they thought it originated in France, and they called it the French flu. So it was just a matter of xenophobia or fear of the other that was still even present back then, where we just blame it on other people.
Yeah, that's it. That behavior hasn't changed, has it?
No, that hasn't changed because Trump called that other thing the Asian flu.
Well, he didn't call it the Asian flu. He called it the Chinese flu.
Chinese flu, yeah.
It was very specific.
He called it the Kung flu.
Right. Yeah.
So human behavior hasn't changed much. Medical science has changed, but human behavior.
Yeah.
Back then they didn't have a vaccine for the Spanish flu, but they were recommending masks and isolation and quarantines. And there was a lot of mask and quarantine hesitation and reluctance back then.
So our past president was no so different than anybody else. It's just that he had to be our political leader at that time. He had the same mentality as human nature. He's just a regular old person.
Yeah.
Well, like was said before, we have a tendency to blame things on other people who don't look like us.
Yeah, that's well stated.
And that's probably why he started calling the China flu. He knew of the Spanish flu and he thought he was just following protocol and just gave it a name like that, a country, which we all found fault with. But
you know what? Not to get off topic, but I found fault with him. The things that he said in the past about Haiti, that it was a swamp. And look what's going on over there now. The people are really devastated there.
Well, I think what's even worse is the way they're treating the Haitian immigrants, which is same old stuff that we've seen time and time again. People that look like us, they flew them back to Haiti. The other people, they didn't fly them anywhere. So
Afghanistan, they flew them by droves in here, and everybody's getting upset, about them not rescuing them, the Americans and the Afghanistans that wanted to leave. We brought them over here, gave them the shots and everything, welcomed them in our homes. Hades, they got, like they said, the slave mentality, the horses and the whips, and putting them back on the boats and putting them back where they were, even though they're having the same difficulty over there. So America hasn't changed any.
nope.
Some of the people from Afghanistan brought measles.
They brought what?
That's
Measles.
right. That's
Oh,
right.
They
Yeah.
brought a lot of different things, yeah.
Mhm.
Mhm.
But I'm happy to see that the United States is, many of the people in the United States are outraged by the racism that they're reflecting by their behavior.
I was wondering, how do Americans go about, like Afghanistan, people welcome them to their cities and their homes and everything, or a place to make for them? Is there a way for us to do that for the Haitians?
You can't do that if you're sending them back by plane.
Right, so it has to be the government that'll help us to welcome them to our homes. I remember once before something happened, devastation, and they were asking Americans if we could take them into our homes. So
I never heard of them doing that for Black people.
Haitians are too dark to get political support.
Right.
Yeah, well, I mean, I never, I heard about it for all other ethnic groups, not for any Black people.
And the governor and lieutenant governor in Texas are making it worse.
How are they making it worse?
Well, the lieutenant governor has said publicly that the Democrats are bringing in all these people, essentially, I'm paraphrasing, all these people who don't look like white people. And they're changing and all these people will be beholding to the Democrats and will vote Democratic. I mean, he said that publicly. And it's changing, this is changing the culture in the country.
Well, that's true, and that's changing anyway. So, but, yeah, but it's interesting. They have a different perspective to those people than they do for the Haitians.
Exactly.
Because the Haitians, they put them on a plane and send them back. So, but it's back to the same old stuff of loving your neighbor as yourself, which we don't do. We may talk about it sometimes, but our behavior is contrary.
oh, I know what I was talking about, Katrina. Hurricane Katrina, when they were displaced and they were well, I know that was Americans with Americans.
Yeah, they were Americans.
They were asking Americans to open up their homes and etc. for the victims of Hurricane Katrina.
Right, that's right, yeah.
Because John and I contemplated, didn't we, John?
I'm on mute.
This is an article that finally comes to conclusion on what the United States is going to be doing. That's to give boosters for 65 and older, and those who are already at high risk. And the vote was pretty good, almost unanimous. And I think most people would accept this, which is suggesting that the general population does not need the booster. And the efficacy of the viruses suggests that the general population may not need it, but certainly the people who are deficient in developing antibodies would, and people over 65 have a reduction in their ability to produce antibodies. So it makes sense.
Dr. Callender, I saw an article where the latest variant, I can't think of the name of it right now, has reached Maryland. Do you know whether they have done any research on that variant? as opposed to having?
No, they don't have enough cases yet.
Okay.
And we have an article about that a little later.
Oh, okay.
But it's not helpful, right? Anybody having reservations about this policy for this booster? Any of us under 60? I guess those who are under 60 aren't here today, huh? And this kind of reinforces that position on boosters for the elderly and high risk, which makes more sense than anything else.
Yeah.
And I think one of the things that affected the vote was the fact that so many people in the world have not yet even been vaccinated. And to spend more efforts to vaccinate, to boost everyone would be kind of a slap in the face to the populations that don't have any vaccine. So it makes sense. And I think the World Health Organization, as well as UN and all groups, should do the best they can to see that all humans are vaccinated. And that should be the number one priority, I guess, which is what everybody is saying. I'm not sure how many transplant recipients or cancer patients have taken advantage of this opportunity. Also, what they don't talk about is patients who are immunosuppressed for other reasons, because you have people with rheumatoid arthritis and other autoimmune diseases who are on prednisone. These are people who should get boosters as well. And I think sometimes people forget that there are so many other indications for using steroids to treat other diseases other than cancer and transplant patients. And they forget that that group of patients is equally susceptible to infection. Why don't we go to the next one? We were killing this horse. This is an article that talks about how getting a booster is not unusual, because all of us get well, not all of us, many of us get flu shots every year, and they are just boosters, except the difference is they are modified based upon the virus that is floating around, which is already variant from how it was before. So the virus booster shot every year is a little different.
I got my flu shot Monday.
And the difference is that these booster shots are the same, whereas the flu booster shot is different every year. It's modified based upon the what seems to be the virus that's coming from Australia and other places.
So Doc, do you think they're gonna modify the boosters for COVID?
It all depends on what the research shows. So far, because of the efficacy of the virus, it seems as though they don't need to. But if the virus would vary so much that the vaccine is not functional, then they would have to change the booster. So far, that's not been the case. So the protection is still there, so they haven't needed to modify it. But it's possible that could come to pass.
Dr. Callender, what was your rationale for saying you're getting the booster shot in October rather than September?
Because many of us older people, especially people close to my age, antibody titers decrease with time. And so if you get a shot in September and your antibody titer decreases in, let's say, March, then maybe a little bit too early. And so that's why my doctor suggested that we get the booster shot in October rather than September. And the flu season usually starts in November, late November, December, and runs through March. So that was the rationale.
I know you've always have said that, and I've always gotten a flu shot every year in October. Last week, my doctor said, "You're getting it right now." I was having a couple of issues, so I hope it's going to be effective through the flu season, but I've already had my flu shot. I got it last Friday.
Well, it's going to be good at least until March. So. And then, you know, that's when somebody asks for, and as you age, see, you're much younger than I am. I'm in my 80s, so my immune system is going to shut down a lot earlier than yours. So it may not be operative for you. But the older you are, the more likely it is to be operative that you may need to get a little later. But for younger people, it doesn't matter. And also, as you get over 65, they give you a double dose anyway. So
yes.
And if they don't, you should ask for it.
Right, I got it.
Dr. Callender, I was just wondering, this is off the subject. You have a physician. Do you ever have, you always have the same opinion as your physician, your doctor?
No. But my doctor suggested I do what my doctor says. I'm a good patient.
You're a good patient?
Yeah. Well, I follow what my doctor recommends. Yeah.
Okay, even if you disagree?
Well, I usually don't have much of an opinion. I haven't disagreed at any point.
Oh, okay. I was just wondering how doctors do it.
Well, I try to follow what my doctor, for example, he has me on levothyroid, 50 micrograms, because he believes that as you age, some of your hormones decrease. And so I don't have any opinion about that. That's his opinion. And I take it because that's what he's my doctor, and that's what he suggests.
And that's
I
why
haven't given much thought to it either. If that's what he suggests, fine.
And that's why they say trust your doctor. If you trust your doctor, it's okay.
Yeah, right. That's what it's, yeah.
I know lawyers listen to their lawyers.
Yeah.
So how do you tell a person, you know, because we had that problem before of a relative that had a doctor who wasn't giving her sound advice. And, but she was trusting her doctor, you know, not saying that not all doctors are perfect. Nobody is all perfect. How do you know if you got a quack or not? That's the wrong word to use.
Well, you can always get a second opinion. For example, if you if you have a strong difference about what your doctor's saying, you get a second opinion and see
Okay.
what they say. That's the safest practice. Get a second opinion.
There's
Somebody
also a
trusted.
source, a rating you can go to find out if doctors have had complaints and what kind of complaints and that kind of thing.
Well, ratings are very subjective. So
Yep, they
yeah.
are.
Yeah, I kind of followed your suggestion, Doc. Last year I got my flu shot the second day of September. So now I waited 3 weeks. You know, closer to October.
Probably as you age, it becomes more important. The closer you are to 60, probably it's less of an issue.
Dr. Callender, I have a question. Because you age and your immune system weakens, those people who are immune suppressed, does that mean that their immune suppressed drugs will increase?
Now,
Yeah,
what
the point is, if your immune system decreases as you age,
yes,
those transplant people who are taking immune suppressant drugs, will they have to take more immune suppressant dosages of the drugs to compensate?
no. Now, are you asking, do they need to take more prednisone?
Well,
Or
not
you
that
asking-
particularly, but just immune suppression in general.
No, you wouldn't need to modify your immunosuppression. You need to modify your vaccination. That's all. That's, for example, why older people take double doses of vaccines. So you wouldn't need to modify your immunosuppression. You need to modify your vaccine dosage. And that's what they've done for older people over 65. They doubled the dose. Well, what we know about kids in the Delta variant is not good. We know that they are transmitting it more, and that they are having complications. And this story is horrifying. It talks about this girl. Go back up for it. So it talks about how, yeah, right there. She was in good health until people in her family became sick with COVID. She began developing symptoms, and the next morning she was found dead. So, and she was 4. So it's we don't know a lot about some of the younger people. We do know now that over 5 that the vaccine is safe, but we don't know about those under 5. But look at this number about children, second highest number of child cases in a week coming down with the virus. So that that's another area that needs to be explored as this pandemic continues to teach us new things about our knowledge of COVID.
This girl got it from her family and not from school, right?
She got it from a family, right?
So the children that are getting it, are they getting it from the school or are they getting it from the families, their family?
I haven't seen the data to get an answer to that question. That's an important question to answer though, but I haven't seen enough data to be able to answer that question.
This morning on the news, they said children under the age of 12 are actually getting the virus at a faster rate and spreading it amongst their peers.
Yeah, between 5 and 12, right.
Okay.
But under 5, we don't know the answer. But between 5 and 12, we know now that the vaccine is safe.
So are they getting it more now that school is open, or is it at the same rate?
Now what, getting more what?
Are they contacting the virus more now that school is open with their peers, or did they get the same amount of, same
I don't know.
percentage when
don't
they
know
were
that.
just with their families?
I don't know the answer to that question. Time will tell. I think it's maybe too soon to tell. School's just opened up, so it'll take a while. Take a few weeks.
Well, school has just opened up, and we've had two grandchildren have to come home and stay quarantined for a while. So if that's any indication, it means it's increasing because when they were
That's not.
home, they were
Yeah,
fine, you know.
yeah. Well, quarantine doesn't mean that means somebody had it.
Right,
Doesn't mean they had it. Right.
right, exactly. So they're going to school, and somebody had it, so now they got to stay home.
Right.
So
Anyway, the data's not in. We have to be patient and wait for it. I don't know any other way to answer that.
And I'm hearing more and more stories of children getting it. My niece is a school teacher and she had a classroom of 18, but within a week, it was a classroom of 5. She said now they're slowly coming back in. They had COVID.
so if that's any indication, it's going up.
Yeah.
At least 439 children have died from COVID. So it
So
seems
one of the
that
things that we did with our twins is we went out and they just turned 3, and we went out and purchased some KN95 masks for them to help them instead of wearing the cloth and the surgical mask.
well, they certainly are the more effective one. Now, this is an article on a lady who was vaccinated who died as a consequence of severe COVID. Yeah, this is their version of the story, but it's interesting. She was fully vaccinated. She got the Moderna virus vaccine, which is the best one, and she visited a friend, unvaccinated friend in Mississippi, and condition deteriorated quickly, and she died. So she was fully vaccinated and still got it. Yeah, so she did have a pre-existing and was already immunocompromised. And and at the time they were not recommending booster shots. Although we had evidence that that was the case. But it does remind us to take the precautions, even though you are vaccinated, because a small percentage of cases who have been fully vaccinated have died, and so that's a wake call for all of us who were relaxing our masks and social distancing as we go to the different concerts and other things. To keep in mind that when you're around people who are not vaccinated, you're at risk. Any other comments about this breakthrough infection and that issue? It's interesting that California would have the highest virus transmission rate now has the low. Of course, Florida and Texas are the other side of the spectrum. 70% of eligible Californians are fully vaccinated. Another 8% have received their first shot. So they are moving towards herd immunity. The vaccination record is becoming very important in terms of going anywhere these days. especially if you go to concerts or programs that are requiring vaccination records or negative tests. Any other thoughts or comments relative to this?
I'm looking at California. I was thinking about our churches that are opening up. What is preventing our churches from asking people to attend only if they're vaccinated? And I was looking at that little lady that was walking in and she had to show proof that she was vaccinated by showing our card. Is there anything legal about that? I guess she was showing her card to prove that she was vaccinated.
Well, you know, it's interesting because our church has a policy that I don't approve. And their policy is, we trust you. If you say you're vaccinated, that's good enough for us. I don't ascribe to that policy.
Why, you don't trust people?
No, absolutely not.
Right.
And of course, Callender's rule that I taught all of my students. I hope they don't forget it. Oh, they will, but I hope they don't forget it. Is trust God. Everybody else has to be double checked or triple checked. And that's Callender's rule. And that should, I think the same way in church. But the ministerial group feels that you should trust. I don't know. I say trust, but verify.
There you go.
Always. And so that anyway, that's the way it is in our church. I don't know about other churches, whether they require to see the vaccination record. So I mean, you who have started church, maybe yours is different from mine, but ours, they say, we take your word.
I don't know of anything around here that they're asking to see your vaccination card. Maybe somebody knows, but I haven't seen a church, store, no place. Where are they asking for these vaccination cards? Because I keep carrying mine in my billfold, and I was wondering, nobody's asked to see it.
Well, if you go to any concert, or they will likely ask you for it. They did at the concert I went to. You had to take your vaccination record with you. If you didn't have it, and you didn't have a positive test, you got a refund.
Yeah, I did a concert at the Echo Stage a couple of Sundays ago. I think it was the 5th. And people had to line up, they had to show their card and a picture ID.
That's right.
If they didn't have the vaccination card, they could get a COVID test. And they said over 200 people took the COVID test. It was a quick test. So within 5 or 10 minutes, they knew if they were positive or negative. And at the same time, they got the PCR test, which comes back 24 hours. So, I mean, it was kind of a good service to those people who wanted to come to the concert. There was about 800 people in the concert, and they had to wear masks inside, even though they were negative, even though they were vaccinated.
That sounds interesting. The band members had to get in the line.
You know, they did not check me. I don't know about the rest of them.
Well, that's interesting because you're the guys who can disseminate it more than anybody else, the band members.
Yeah, your trombone has to have a breathalyzer test.
That's interesting because that's missing the boat in a number of ways, because the performers are more likely to be able to disseminate it than the other people.
And we don't wear masks on stage. Off stage, yes.
I don't mind you not wearing a mask if you're vaccinated,
Right.
but if you're not, then that's a problem if you test everybody except the performers.
But more and more often, especially recently, you're seeing fewer masks, and they take your word for it. As Dr. Callender said, you should never just take the word. And I was in the restaurant yesterday and I noticed almost no one had a mask on, not even the waiters, very few. But then there was a note on the door, if you're vaccinated, you don't have to wear a mask. But no one asked.
Yeah,
You
well,
wear
trust.
your mask. In other words, to
Yeah.
protect yourself, you do it. But most of the people, I did. And the few people that I was with, they did. But that's the note. If you're vaccinated, you don't have to wear a mask. And
Yeah,
the majority of
that's,
them did not.
yeah, that's, you know, that's what they said at first in the movie theater that I went to. But by the second week, they changed. Everybody had to wear masks.
Yeah.
This next article is kind of controversial. So, and it has a video link. Maybe at the end we can watch it. It takes about 4
Okay.
minutes.
You can go to the next one. Okay. Oh yeah, that's an interesting article. This one about Nikki Minaj, who didn't believe in being vaccinated, and she indicated that, and they got into a discussion about whether or not vaccines were necessary, and she then challenged her, and they talked about some of the misinformation that we'd talked about earlier. And they challenged it, and then the result of their challenge is that she developed a rap song.
And here lies the whole purpose of her doing this whole thing.
Yeah, well, yeah, it's amazing how people respond to the challenge of the vaccine. But of course, it's not distrust of the vaccine, it's distrust of the system. It's both. Because as Buchanan said before, the whites, blacks, greens, and purples are getting the vaccine. So I don't know what you're concerned about. But anyway, 76% of the United States people are getting the vaccine.
You know, for me, when a popular person comes out with something, you know, unverified, you know, the hesitancy or the even not just the hesitancy, but saying, "Hey, I'm not getting the vaccine, and this is why." And you know, a lot of people listen to them. That social media is so
That's
powerful.
right.
You know,
Yeah, it's kind of sad.
And the negative aspect is strong because it puts that doubt in your mind. You know.
Yeah.
How well we remember Oprah Winfrey and the mad cow disease.
What happened with her? I don't. What did she do?
She came out saying that certain meats and meat products would cause mad cow disease. And she had all the farmers mad at her about that.
Oh yeah, especially since mad cow disease is untreatable, and if anyone is suspected, all of the cows are killed because we can't treat that effectively.
I'm gonna try to play this video. Okay.
Yeah, she decided she'd rap and try to give us some truth to her misinformation.
Don't forget the bottom left corner of your share screen.
Twitter, one of them on your screen now. In it, she claims you had to be vaccinated to attend the rapper Nicki Minaj.
Oh boy, let's see.
Recording in progress. This all comes from some tweets that you posted on Twitter. One of them on your screen now. Claims you have to be vaccinated and the Met Gala on Sunday, but she won't get the shot until she's done enough research.
She heard that her cousin's friend got vaccinated and became impotent. His testicles became swollen. Ouch.
My name is Dr. Raven, the Science Maven. I'm a molecular biologist and science communicator. I understand all angles of this conversation with Nikki saying, I want to do more research. I don't want to be pushed into a corner just because I have to go to this and that. And then I understand people feeling frustrated because it's been over a year and a half now that we've been in this pandemic and the vaccines have been available for months and months and months now. There needs to be room for all of those feelings. And I don't think it's fair for us to force people to feel a certain way about decisions that they make about their body. So I offered Nikki an opportunity to chat. I am an educator. I've taught in K-12 spaces. I've taught at university settings. I'm also a rapper. I make science rap music. And I happened to last year have made this video and I wrote a song called Antibody. And everybody calls it the Antibody Yachty song. Everybody asking me, what's a vaccine? That be scientists in the LAB. Check the for the right nucleic acids and proteins. We making sure to build up here that the community is body, antibody. It's been used as a teaching tool to get people acquainted with the terminology around the immune system, about vaccines, about what's going on with our bodies when we receive vaccines at the cellular level. And, you know, it's a video that I made to help a student study for their microbiology exam last year, but I've learned that it's also helpful for people to just hear the words, see a face that's friendly, and hopefully they're able to kind of dig in deeper in the song and learn about their meanings, the meanings of the words. It's important for people to just see that interaction of, here's a scientist that cares, here's a scientist that understands how to communicate in a way that's not like an academic journal that nobody can understand, or using, you know, I did use big words in the song, but I did it in a way that invites you to dance along to it. You know, a lot of people are frustrated and it's becoming more of an emotional thing. Like, how could you not at this point trust the science? And what does it mean when people say, well, I still want to do my research? The way that I interpret that is I'm still looking for somebody I can trust, or a source that I can trust to listen to. Because when scientists do their research, we analyze our sources as well.
Well, that's interesting. Yeah. Anybody understand the rap?
Like,
I
don't
didn't.
understand the songs. I don't understand the rap.
I didn't.
Yeah.
I'm not into
That's
rap. I
because,
really
that's
don't know.
because all of y'all are over 60 and nobody over 60. Maybe Daryl can because he's the closest one to it.
Well, I'm not 60, Carol Tatum, and I did not understand it because I don't like rap music.
Okay.
Okay.
Maybe that young lady that's with Pearlinga understood it.
Yeah, well,
No.
Okay, well, I guess you're right. Maybe for another generation.
Mhm.
That generation that's not taking the shot. Maybe if they heard it.
Yeah, yeah. Well, they listen.
Yeah.
Okay,
Betty, you can show it to your grandson and he will
How about
interpret it for you.
Yeah,
Uh-huh.
yeah, he would.
Yeah,
Uh-huh.
I actually felt the same thing about Hamilton. I remember that
Oh, yeah.
rock opera.
Just Right.
$39 for full coverage.
You know, prior
right?
prior to
The
prior
reality
to
is more
Hamilton,
expensive.
prior to Hamilton, I would say that I don't like rap. In fact, some of the content was bad, you know, to say the least. A lot of the subject matter and the language and the misogynistic content. But when I heard the idea of rap, which kids love, applied to something historical or, you know, I mean, I loved it. Hamilton was an awesome event, you know, and to hear rap applied to something positive was really, really, really great. So hearing this, I was open to hearing this doctor do rap, which I thought was pretty cool.
I heard Hamilton, but I still could not understand it. Some parts of it, I never went to the theater. They had a presentation on television and I did listen to it and I could glean some of just by knowing some of the history, but just trying to follow the songs and it was too fast for me.
That's the key. See, now I'm a rapper, and I know that you have to hear much at a faster pace to either rap or to listen to rap. And the problem with you old folks, you don't hear fast enough.
That's true.
You know,
And what are you, my little brother?
I'm 72, but my ears, I have 25-year-old ears.
you know, what was awesome about the performance I attended, which was at the Kennedy Center, they had a big screen, like a 5 or 6 foot wide, 2 feet tall, digital screen on the side of the stage that had all the lyrics real time, so you could read what they were saying exactly as they were saying. It was awesome. But also prior to seeing Hamilton, my wife loved it, so I listened to it. She wanted to go. I didn't want to go because it was rap, but listening to the DVD, you know, ahead of time, you know, I could, and it had all the lyrics in the DVD jacket. So I would recommend that if you wanted to see it again.
Yeah.
I enjoyed Hamilton.
I saw it in New York, the performance. I loved it. I understood it better. It was the flow, the song, it streamed, as opposed to just saying the words. It was great. So I preferred the rap. It was good.
It was good. I agree.
Yeah.
And I think what we listened to this morning, I will go back and listen to it again. I'm keeping an open mind, and I will listen to it again to see if I get it.
I think whatever we can do to get positive information out to the younger people is a plus.
Right.
You know, they definitely listen to those rappers, to those to their heroes. You know, a lot of them pay more attention to rappers than they pay attention to their parents
and their school teachers.
And
Nicki Minaj is more on their line than that doctor. They'll probably listen to Nicki more than they would that doctor.
They would probably look at her more.
Yes.
They listen to Lil Wayne.
Lil Wayne.
Yeah.
Okay, so any other comments? If not, I guess we're done for the week. Hopefully next week we were able to get another one of our speakers to